So the common complication of a hemodialysis catheter, as most of you guys are well aware, are three things: thrombosis, occlusions, and catheter-related infections. The thrombosis, the primary patency of these catheters are usually about 65 to 75% at 1 year, which is devastating. As far as occlusion is concerned, 1 in every 3 catheters that require TPA by the day 41, with 59% requiring more than 1 TPA administration.
Silenciado.
The usage of the hemodialysis catheter. And the worst part of it is the risk of bacteremia in catheter-dependent patient is nearly over 50% at 6 months. Thrombosis catheter, if you look at it, has quite a financial implication due to the catheter dysfunction. As you can see in the slide, at a total cost of a catheter dysfunction is about $362, and estimated cost to institution per catheter per dysfunction is about $110. And given there are over 300,000 patients who received the hemodialysis catheter in 2009, this sort of translates into over almost $40 million per year just due to the catheter dysfunction. The Indexo technology, which is a basis for the bioflow catheter, combining the Indexo polymer with the base resin polymer via this new thermoplastic extrusion process. So they're integrated within the actual catheter itself. So unlike the coatings that are superficial and impregnated agents that are transient, the bioflow technology is integrated and non-eluting polymer technology that passively imparts the thrombo-resistance property to the indwelling catheters. It is permanent and non-eluting and is present throughout the catheter lifetime, pretty much, including the both extra and the intraluminal surfaces. So our study was to evaluate and analyze the preclinical data regarding the efficacy of the Indexo technology-based dialysis catheter called the BioFlow DuraMax in achieving improved thrombo-resistant and hemodynamic profile. The method was we did 4 different preclinical translational research projects. One of them was an ex vivo in bovine model. The second one was in vivo in ovine model. And the third one is a computational dialysis transonic recirculation model. And then at the end, we did a computational comparison study of these in comparison study with the 2 non-Indexo dialysis catheters. And we looked at thrombo-resistance, material tissue adherence, MTA, recirculation rate, and in-dialysis pressure. So the thrombo-resistance test was using this ex vivo, the model, using the fresh heparinized bovine blood that's combined with the autologous indium labeled platelets. The inner loop, as you can see on the right side, is where the catheter is actually connected as simulating the dialysis process, and the outer loop, which is simulating the circulation where the catheter is inserted as the natural physiological sort of process and the steps. And the inner loop was dialyzed for about 30 minutes, and then it got saline locked, and post that 90-minute additional outer loop circulation was continued to act as a physiological circulation. And at the end of 2 hours, the catheter was explanted. Then thrombose quantification was performed using the gamma camera. So here's the first result of the thrombo-resistance test. Compared to non-bioflow, the catheter, we compared it to one which is non-coated palindrome, and the second one was a heparin-coated palindrome. As you can see, the bioflow has a reduction of over 85%, almost 85% thrombosis reduction compared to the baseline, the palindrome, in both exams, and it was statistically significant. The second test we did was the material tissue adherence. It was in vivo study using the polypay sheep jugular veins. The catheter were placed as we will normally place daily, and we compared the bioflow versus heparinized coated palindrome. And 31 days after the insertion, the catheter was explanted, and the three segments, as you can see it in the image here, proximal, mid, distal towards the tip, were analyzed both macro and the microscopic examination to validate the material tissue adherence or assessment. Here's the sample image of the electron microscopic analysis. The right side is the heparin-coated palindrome, and the left side the bioflow Duramax SEM image. As you can see here, there's a lot more the materials. This could be the thrombogenic materials or tissue. They adhere to the surface of the heparin-coated palindrome compared to the bioflow Duramax, where very minimal materials are attached. And these are same magnifications. Overall assessment have demonstrated, again, three different segments: proximal, mid, and the distal part of the catheter. And as you can see, the proximal and mid, the MTA was not statistically different between those two groups. However, distal towards the tip, there is a significant difference between the heparin-coated palindrome and the bioflow in terms of material tissue adherence, as you can see, almost doubling the amount, which could be implicating in the actual circulation through the tip of the catheter in the bioflow compared to the heparin-coated palindrome. The third test we did was the recirculation rate. Basically using the dialysis transonic recirculation test method, as you can see on the left side, from the simulator, this overall flow directed this way around towards the glycine water mixture down back to the simulator heart is the normal circulation we're simulating. And here's the catheter insertion portion. And we're simulating dialysis on this end and see how much of a recirculating is occurring at the tip and the tip of the catheter, which could be the contents of the dialysis. And as you know, the recirculation is the measurement of how efficient the dialysis catheter is. And an efficient catheter with a low recirculation percentage basically means it aspirates the dirty blood into the dialysis catheter without aspirating the clean blood being back into the patient. So again, this is sort of the cartoon schematic of what bioflow catheter looks like. It has arterial lumen, which is approximately getting aspirating the blood in, and venous end, which is releasing or infusing out of the catheter. So when we discuss the in-flow direction, the blood is aspirated into the arterial lumen and infused out of the venous lumen. When we talk about the in-reverse flow, the blood is aspirated into the venous lumen and is infused out of the arterial, which is obviously the vice versa. And it has two different implications. So here's the result of the recirculation rate study. So first, the graph is demonstrating the forward flow of a recirculation rate and comparing between the palindrome versus a bioflow. And as you can see, the bioflow had a 0 recirculation rate in all three different flow rates at 200, 300, and 400 milliliters per minute. Again, significantly different from the palindrome groups, which demonstrating how efficient the dialysis, the rate or dialysis system is for the bioflow. However, if you look at the reverse flow, it kind of completely changes the sort of schematics, as you can see, at having the bioflow having significantly higher recirculation rate compared to the heparin-coated palindrome, which is due to this design of the arterial lumen before the venous lumen, where the blood, if it's reversed, anything that's released out of our arterial lumen can get aspirated by the venous lumen, and that's the reason why it has higher recirculation rate compared to other catheter. The next thing we looked at was in-dialysis pressure. A test method was to use the dialysis flow rate versus a pressure test method. And it's looking at, again, recirculation rate as well as the actual in-dialysis pressure. The pressure versus flow is the measurement of how much pressure is generated by dialysis catheter at the various flow rate. Again, we looked at 200, 300, and 400. And all dialysis machines have a pressure threshold that once it's exceeded by the machine, that the machine will stop. Therefore, lower in-dialysis pressure is better. Again, there's a two different set of the data. The first one on the right is the forward flow, and the second one is the reverse flow. And as you can compare again between the palindrome versus the bioflow, you can see a significant difference in all three flow rate in 200, 300, 400, that the bioflow has the superior in-dialysis pressure. Again, the lower the in-dialysis pressure is the better compared to the higher one, as you can see here. And all categories, both forward and the reverse, that the bioflow show the superiority. So my conclusions are the Endox technology-based dialysis catheter appear to be superior in several places: thrombo-resistance, distal tip material tissue adherence, forward circulation rate, and in-dialysis pressure compared to non-Endox catheters that were tested and compared. And obviously, future clinical research will seek to validate these findings. And just to add, very recent Society of Interventional Radiology meeting, which happened last weekend, and there was one study coming out of a Chicago Rush University group, have a first clinical study retrospective that presented 103 catheter placement comparing the bioflow Duromax versus the EcoStream, which is a non-Endexo catheter. And what they have shown is at the 50-day follow-up point, the patency rate of a bioflow was 95% versus the other catheter, which is a 73% with statistical significance. It also showed the catheter malfunction rate, and the bioflow had a 17%, whereas the other catheter, EcoStream, had over 30%. The catheter malfunction. Again, this was a statistical difference, and they also started proving clinically that the superiority of Endexo technology-based bioflow Duromax catheter has much better efficacy as well as the long-term patency in the dialysis catheter world. Thank you.
Thank you very much, Dr. Lee.